Hello everyone, and welcome to Dr. Explains. Today, we're going to talk about type 1 and type 2 diabetes. Although both conditions are called diabetes, they are actually different diseases with different causes, treatments, and ways of managing them. Many people think diabetes is just one disease, but that's a common misunderstanding. Understanding the difference between type 1 and type 2 diabetes is important because it helps people recognize symptoms, seek the right treatment, and make informed health decisions. In this video, we'll compare both types of diabetes, discuss their symptoms, explain how diabetes is diagnosed, review treatment options, and learn how type 2 diabetes can often be prevented through healthy lifestyle choices. Let's begin. Diabetes is not just one disease. There are different types of diabetes, and each develops for different reasons. The two main types are type 1 diabetes and type 2 diabetes. Type 1 diabetes occurs when the body's immune system attacks the insulin-producing cells in the pancreas. As a result, the body can no longer produce enough insulin. Type 2 diabetes is different. In this condition, the body still produces insulin, but the body's cells do not respond to it properly. This is known as insulin resistance. Although both conditions cause high blood sugar levels, their causes and treatments are different. Let's take a closer look at type 1 diabetes. Type 1 diabetes is an autoimmune disease. This means the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without enough insulin, glucose cannot enter the body's cells to be used for energy, causing blood sugar levels to rise. Type 1 diabetes usually develops during childhood or young adulthood, but it can occur at any age. Because the body cannot make enough insulin, people with type 1 diabetes need insulin injections or an insulin pump for the rest of their lives. Now let's look at type 2 diabetes, which is the most common type of diabetes. In type 2 diabetes, the pancreas still produces insulin, but the body's cells become resistant to it. This means insulin cannot work effectively, causing glucose to remain in the bloodstream. Type 2 diabetes usually develops in adults, although it is becoming more common in younger people because of unhealthy lifestyles and obesity. Treatment often includes healthy eating, regular physical activity, medications, and sometimes insulin if needed. Now let's compare the two main types of diabetes. Type 1 diabetes is an autoimmune disease that usually develops at a younger age and always requires insulin treatment. Type 2 diabetes is mainly caused by insulin resistance and is more common in adults. Many people with type 2 diabetes can manage their condition through healthy lifestyle changes and medications, although some may eventually need insulin. Understanding these differences helps doctors choose the most appropriate treatment for each patient. Both type 1 and type 2 diabetes can cause similar symptoms. Common symptoms include increased thirst, frequent urination, increased hunger, unexplained weight loss, feeling tired or fatigued, and blurred vision. These symptoms occur because high blood sugar affects the body's ability to use glucose for energy. If you or someone you know experiences these symptoms, it's important to visit a healthcare professional for proper testing. Doctors diagnose diabetes using a few simple blood tests. The most common is the fasting blood sugar test, which is done after not eating for at least 8 hours. A fasting blood sugar level of 126 milligrams per deciliter or higher on 2 separate tests indicates diabetes. Another important test is the HbA1c test, which shows your average blood sugar over the past 2 to 3 months. An HbA1c level of 6.5% or higher is considered diabetic. Doctors may also perform an oral glucose tolerance test, where your blood sugar is checked 2 hours after drinking a glucose solution. A result of 200 milligrams per deciliter or higher indicates diabetes. Finally, a random blood sugar level of 200 milligrams per deciliter or higher, along with typical symptoms, can also confirm the diagnosis. Your doctor may use one or more of these tests depending on your condition. Although diabetes cannot always be cured, it can be managed successfully. Treatment includes eating a balanced diet, exercising regularly, taking medications or insulin as prescribed, and checking blood sugar levels regularly. Following the treatment plan helps keep blood sugar under control and reduces the risk of serious complications such as heart disease, kidney disease, and vision problems. Working closely with your healthcare provider is an important part of diabetes management. While type 1 diabetes cannot currently be prevented, many cases of type 2 diabetes can be prevented or delayed. Simple lifestyle choices can make a big difference. Eating a healthy diet, exercising regularly, maintaining a healthy body weight, avoiding smoking, and having regular health checkups all help reduce the risk of developing type 2 diabetes. Remember, prevention is always better than treatment. Before we finish, let's review the key points. Type 1 and type 2. Diabetes are different diseases with different causes and treatments. Recognizing the symptoms and getting tested early can lead to earlier diagnosis and better health outcomes. A healthy lifestyle helps prevent or delay type 2 diabetes, and regular treatment and monitoring reduce the risk of complications. With proper care and support, people living with diabetes can enjoy long, healthy, and active lives. Thank you so much for watching this video. I hope you found it helpful and learned something new about diabetes. If you enjoyed this video, please give it a thumbs up, leave a comment below, and subscribe to Dr. Explains for more simple and reliable health education videos. Take care of your health, stay informed, stay healthy, and I'll see you in the next video.